Hello? Now it's working. Sorry, Cindy. Yes.
Would it be reasonable to provide her a brief summary of the actions that have just transpired?
That would be fantastic if you all don't mind doing that, because she would love to know who.
Yeah. All right, Cindy, can you hear us now?
She missed out on everything.
Yeah,
Beginning.
But what did we,
Okay.
what'd she miss, I guess?
Meeting was called to order. We passed the, all members of the board have unanimously agreed to continue in their current positions.
And who motioned that? And who seconded it?
Kim
You
motioned
did
it
all.
and Susan seconded it,
Yes.
Yes.
and the
That is
board
unanimous.
approved it unanimously. Subsequently, we reviewed the
Minutes.
banking services, which was approved unanimously for Nottaway Bank.
Minutes.
And
Minutes.
I made the motion and Zach seconded it,
And then was unanimous.
and it was unanimous.
And then the minutes, who did the minutes?
I
did the minutes.
I did the minutes and
I didn't second.
Okay.
just say Zach seconded.
Yeah.
Okay.
Yeah, all right.
And then unanimous again.
Yes, I did.
Yeah, it was unanimous vote on that, and that's it. And we are taking up,
Deferred the bylaws.
Deferred bylaws.
bylaws were deferred till next month.
And now we're on the director report.
We're on director's report now.
Is that thumbs up
Okay,
from Cindy?
so
Did you hear us?
She's been listening.
Cindy, did she text that she could hear us now?
Yes.
Okay,
Okay.
perfect. So revenue so far this year, we are at 67.4% of our projected revenue, which is about 2.6 million. Our expenditures are right at target, so about 23.6%. And we, at the end of March, would be 25% through the year. Our current money market balance, 2,812,498, which is about $52,000 more than we were last year. Our lease purchase debt obligation, we are about 243,683 less than we were last year. I think I've mentioned, and I'm sure I have, but we are paying the additional principal and everything at the beginning of the year. So we won't see a lot of jumps throughout the year, but every January, we're going to see a fairly significant dip. And we're still on track to most likely finish within 10 years. So that's good. A couple things, and I think Taylor, you might want to talk about it a little bit, but we had our strategic planning retreat for the staff. Was that yesterday? No, 2 days ago. What were your impressions and what were the things that the staff came up with as our 3 priorities?
So we had 2 people come from the MOSIFI is now going by the Missouri Public Health Institute, or MOFI, which they're kind of under that. So we had 2 people from that organization come to kind of facilitate the training, and we went out to the Heartland Center for the whole day, and we did a SWOT analysis looking at the strengths, weaknesses, opportunities, and threats or challenges. And then we also did like a revision of the mission, vision, and values. We got a lot of good feedback. They said that, well, what the person organizing it, she said that it was overwhelmingly positive. She said that normally people have a lot more weaknesses. I don't know if she was just, saying that just to be nice, or if that was actually true. But we had a lot of people say that there's, a lot of people with lots of great experiences, lots of years of experience, lots of great things at the health department, that we offer a lot of resources. And so I think that we're planning on taking all of that information, and she's going to compile it. We're going to meet with her on Monday. And I know all of you were sent out some information. I think that there were two different things. One was looking at that SWOT analysis. I think we got 3 responses from that. So thanks to who filled that out. And then the other one, nobody filled out, which was the review of the mission, vision, and values. I think there was a problem with the link though, because I clicked on it and I couldn't get into it. So now it should be
I thought it was
working.
my phone.
I couldn't get it, and I spaced off and insane, so I'm bad.
I was like,
But it should be working now.
yeah.
Okay, can
So
you-
if you guys
Can
have
you
a
send the link
chance
again?
to, yeah, I can
Please.
resend it.
I'll be a
I'll
better
try.
board member.
I did the other.
Yeah, so I mean, if you guys can contribute to that too,
When's
so
your
that
re-election?
also is included in part of that, and then she's planning on coming to our June meeting to kind of walk through some of that with us. So,
And can you cover where we ended up, or do you not have that yet?
I don't know what you mean.
We came up with 3 priorities that were overwhelmingly voted on by the staff.
Okay, I think that she was gonna compile that information and give us the official.
Okay, we'll
or do
be
you remember?
reviewing that
Okay.
next time, but overall, it was, you know, this is my Cliff Notes version, so it won't be exact, but it was actually consistent with what we are trying to do, which I was pretty happy with, but it was staff development. It was more educational opportunities, more developing of staff and opportunities within the staffing structure as far as succession and different things. So that was one big area. Another big area was like really codifying our practices. So as we go through accreditation, that is one of the things we, like Dan has super been working on, cranking out policies and procedures before he's leaving. And that was one of the things that staff asked for, was to really put things in writing. And, you know, for new people especially, like people that have been around forever know how we do it. People that are brand new, they're taught something, but then if they don't have that reference to go back to, it's kind of hard. And so just getting all these things in writing in a consistent format, like, and we may have discussed it here before, our current policy and procedure, it's pretty comprehensive, but it's been done over kind of decades, right, Dan? So it's not really exactly the same type of structure throughout, and sometimes that's a little hard to navigate. So our new one will be starting with the things we absolutely have to have for accreditation, and then we'll be building on that with the things that we really need on a daily basis. But I think it's coming along. It's a big task, and I think it's hard. I mean, to capture everything and to keep everything together. But I think we're growing as a team because of that. And then what was the third area? It was kind of just more on the building.
Was it social media and communication?
It was communications, yes.
There's some data, somebody gives some data.
Yeah, that was tied in with the communications, I think. So especially like the website, I mean, a lot of the stuff was getting information out to the citizens and really looking, and like Dan said, the data, making sure we are doing our chip and chaw and getting the services out to the community. So I actually couldn't have been more happy with what the team came up with, and it was not like there was no influencing. It was, we had blank post-it notes and we were to do the SWOT analysis. So I was very proud of the team. There was a lot of good statements, like very honest, truthful things. So I don't know if part of the process is we'll be rating the experience, but that might be something you might ask Jill to do.
Evaluation.
Yeah.
Andrew and I have talked multiple times, and I'm just gonna tell everybody, that we really want to push our staff to become the bigger, better persons that they are. So, you know, push themselves to be, someday to be a director at a different health department. I know like Wyandotte had an opening or whatever, right, for the director. I would expect a lot of the leadership people to be applying for all that. Even if you don't get it, at least you tried, go through the experience, right? Keep pushing yourself to be bigger and better, right? I would love to keep all of you here, but this is your career too, right? And so it would be like me for training. Sometimes I had to like leave. I had to go to Connecticut for training. I want to move to Connecticut at the time. I loved it there, but I didn't want to go there until I got there. Then it was pretty cool. But you have to push yourself, and I expect the leadership and all the executive staff or whatever to push themselves. And you agree, I hope, right?
I did.
Yeah.
Dustin actually, well, he's applying to, MU for their NPH program. So, I mean, that's exactly the type of stuff we want to see in our staff, is looking to get the education and the experience. So they're the entire package for whatever that next opportunity is.
I don't want you guys getting over your skis and then fail. I don't want that to happen, right? So you do need to have that comfort level and experience. However, you do need to push yourself. Right? That is kind of an expectation that you're pushing yourself to something bigger and better.
The other thing I just want to mention, and we have had it posted, and I think Dustin is working on the interview questions, but Dr. Parker, our medical director, is going on to a different opportunity, which prevents her from being our medical director. She can't be certified in some things we need her to be certified in this new endeavor for her. So we have four people will be interviewing.
Is it 470?
But we posted it for less than a week and we had like 12 applicants.
Wow.
What's the specific criteria that you need? Is this personnel we can't talk about?
Huh?
Is this a personnel thing? I don't want to get us in trouble.
Be a physician.
So you have to be a physician.
Yes.
And what other criteria?
We are looking for someone who has experience in vaccines, STIs, and TB particularly,
Okay.
because that's mainly what we're dealing with in our clinic. I mean, at one point when we ran primary care, it would have been a wider breadth of expertise, but now it's primarily those types of things we're looking for.
And they would be a full-time here, or are they just
No,
helping out?
It's almost all remote. It can be done remote. For a lot of it, we did ask that they come in at least once a year and spend a day. But be available, fairly. That's part of what we'll be asking, is what availability will be and that type of thing.
It's like since the transition to family healthcare, Dr. Parker has always been available by phone. So if we have any questions, we just reach out to her quickly or send her an email and then she responds back.
And there will be trainings and stuff they'll have to do.
So who would be like the optimal candidate, like an infectious disease expert or something, or what are you thinking?
I hate to say this, but like, honestly, we do a lot of vaccinations and a lot of childhood vaccinations. So someone who knows about pediatrics is.
PEDS ID? That's my training, but that's double dip. I can't do it.
Or someone who has a passion for it and can bring themselves up to speed on the current doctrine.
Right. Yeah, I know someone that I encourage to apply, and he's in the people we'll be interviewing, but he's pretty passionate about those things. So we'll see.
And do they have to be local, or
I have to have a Missouri license.
They do a Missouri license? That's key too, right there.
Yeah.
Children's Mercy has tons of like elite PEDS ID specialists. Just saying. I don't know if any of them applied, but
Yeah,
I'll be neutral. I won't stick my nose in it.
I
I'm
don't
just
know
saying.
who all applied.
Yeah, not a ton of local.
Dustin and Cynthia have been
interested
kind
to
of
see.
looking at that.
Who's the,
It was so we did get quite a few were like from various parts of the country who are kind of doing like everything telehealth. So we think we're like apply. Yeah. So we did do like some follow-up questions, kind of get, like weed out some of those and seeing like, all right, are you Missouri licensed? Are you Medicaid credentialed in Missouri? Are you going to come here at least once a year? And just particularly for those who are like live in states like on the East Coast and West Coast at your own expense, not on the health department's dime necessarily. So and some follow-up questions like that. So that narrowed it down to from like what 12 to 4. So,
And Dustin and I talked about the interview questions, and he's going to be putting together questions that are really geared towards what he needs and his team needs during the day. And like, how responsive can you be? And, you know, most of it won't be necessarily on site, but he does need answers fairly quickly, not 3 weeks from now, right?
So you need to have them on speed dial, is what you're saying.
most of the everything isn't an emergency, but within like a 24 hours time of response, and or like, hey, I'll look like Dr. Pecker's great, but like, hey, I'll look more into this, and then like it'll be a few hours later, I'll have like this whole email, like all like these references and things and highlighted and what her recommendations are. So
And I think that's all I
Yesterday we hosted the Department of Health and Senior Services spring regional meeting for regions. Is it A and H?
I don't know, but that was the thing I forgot.
Well, you can jump in anytime.
No, go ahead.
But it was good. They talked a lot about contract, well, a variety of topics, but contract invoicing and reporting processes that I think are changing as things evolve. Really interesting presentation was on the legal authority under which local health departments are formed in Missouri. So that stuff I thought I knew for, the last 30 years or so, and it's enlightening. I learned a few things. We learned about a lot of resources available for both accreditation and communications and various other topics, public health topics. So that was good. And it was good to show off our facility. I think people always feel comfortable visiting here, so that's a good thing.
So it was the Northwest region, so it was all, or a lot of the health directors from throughout the Northwest part of Missouri. Some of them had never been here. So it's always, honestly, it's always fun to show this place off, that we have such a great place to serve our citizens. And one of my old colleagues, who was actually my assistant director and person who was over accreditation at the City of Independence, who's now the director there, she came and she got the tour and was like, this is pretty much the best thing I've ever seen in my life. So that's
Hold on.
to hear. But it's fantastic. Just the thought and the work that went into this place is phenomenal.
You guys did a good job.
It was last Friday, Andrew and I had the privilege of meeting the new Department of Health and Senior Services Director. She and the Deputy Director came here to visit with us, and of course they got the tour as well. But it was really a pleasure. I think they both seem very, very down to earth and really want to hear what the local health departments have to say and what our concerns are. I think they seem focused on continuing the statewide focus on those foundational public health services, and they're hearing what a lot of the health departments are saying about some of the challenges that they've had in the past with contracts and a variety of other things. So I think they're going to be good. We're looking forward to building that relationship.
And her name is Sarah Wilson. I
Sarah
don't
Wilson.
know if you said that. With 2 L's. And then the deputy director is Tim Van Zandt. And I did not have his email, so I had to do some cyber stalking. And I learned that he was in administration with St. Luke's hospital system. So I don't know what his position was exactly, but that's where he came from. And he started on the 7th, I think, with the state. So that was kind of like his first week, right?
Yeah.
But both of them were very personable. They indulged us on another tour. And so they were pretty impressed also.
Very cool.
So maybe I got that out of my system for a day or two.
And then the rest of my report, I kind of gave you an overview of what we used our ELC-ED contract funds for, but we have expended all of those funds, which Andrew may have talked to a couple of board members about why we're happy about that. Some health departments are experiencing issues with some of that money being reclaimed by the Department of Health and Senior Services, ultimately, I guess, the federal government. So we were fortunate that and appreciate the board's willingness to let us use some of that funding on improvements to the infrastructure here and improvements for staff. But we also used it to support a lot of our work with throughout the COVID pandemic and testing and vaccination. So.
Yeah, I think Dr. Chappé was here earlier today, and I'd mentioned to him that some of that money went to fund parts of the clear story windows that we had to put in because they were leaking. Some of it was for the generator, but we used that money very quickly so we could put it into the building and not incur debt, but use that for something that would serve the citizens for a really long time, and not having water leaking from the ceiling seemed like a pretty good idea. But we were very fortunate. And in fact, that drama has kind of been ongoing for about 6 months, even before the administration changed. Some of the rules were changing and different things. And we were in a great position because we were able to say, we're done with it. But the final kind of report just got submitted. So great job to Dan and the finance team for getting that all buttoned up and us totally out of that business.
Well, and finally, I'd like to give the HR and finance team another pat on the back. I know they worked hard on the banking services, but they've also been working with transitioning to Paylocity and our time clock management processes. And then we are working on completing our contract for our financial auditing services with Kenny Hales. So we should be hearing soon or seeing soon our latest financial audit for last year, but they'll be coming soon. Any questions I can answer?
So the SWOP Health Services, you met with the reps about discuss our partnership, look for opportunities better serve. By pure chance, a few days ago, my wife asked me, she goes, so did you guys ever finalize that SWOP thing? And I said, yes. She goes, I don't see any advertising or anything. So you sure? And I said, yes, we did. So is SWOP going to be advertising or marketing in the community so people are aware of this opportunity here?
And Dustin, please feel free to jump in. But
because we started a new round of meetings.
Yeah, we have. This week was our second meeting we've had with them, and we actually had that has been a topic of discussion, the marketing and but
yeah, I'll come in here. So Dr. Jamal actually kind of mentioned that in our last meeting here, and what happened is like whenever we had the transition, a lot of clients ended up going to places that were closer to them, like Maplewood, Swope, over at Riverside, and then there's here. So all the family healthcare patients we once had coming here had some other places that were much closer. So the numbers aren't as high as what they were once here. So that's why we're seeing just decreased numbers on that. So their goal and focus right now is trying to revamp and like trying to attract new clientele here. And we've also partnered them with Jill Ballard, our new marketing specialist, public information officer. That way she can work on sharing some of that information and getting out in our social media and kind of helping them assist like promoting that services here.
So at their last meeting, is her name Angela, their PR person?
Yes, Angela Smart.
She wasn't there, but that is basically what we had suggested was, give us stuff to put out through our outlets. We will put it on. I mean, you're clearly our partner. We want to put this out on our social media, on our Facebook, on our Twitter, all these things. I mean, let's figure out what we need to do as far as even some more signage inside the building. But she is supposed to be coming. We're meeting weekly, right, Dustin?
Monthly.
But she will be at the next meeting.
Does SWOP do billboards around town? I mean, is that something that they don't have the marketing budget for that?
I'm not sure.
I don't know.
Not just here, but just in KC Metro period. Do they do something like that?
I want to say that I may have seen one somewhere, but I can't confirm.
What about information through the schools too? I mean, promoting
I would think that would be a good
Yeah,
place.
that's good
Yeah,
suggestion.
we'll suggest it to her.
Are there any geographic logistical challenges to folks who are not in the southern part of Platte County that we need to be aware of, all of us as a team, to identify if there's a potential opportunity for a remote location, perhaps say some town, small town that has a doctor's office that space could be leased once a week or whatever to, are there any unmet needs that we can be aware of that are physical geographic challenges to the citizens of Platte County that we could be more potentially responsive to? And along those lines, you can find creative ways of, if people can't physically get down here who have a need, can we set up a situation that doesn't cost an arm and a leg to the county, but still provide location services or something? I'm just thinking outside the box, trying to identify the fact, or accept the fact that we're located where we are. There may be people physically located elsewhere that need access to the services, and I'm not sure how that evaluation process should ensue.
So transportation continues to be an issue. There are some funds available through, and I'm going to get it wrong, always, because I always get it wrong, through Medicaid, right? Dustin?
Children or adults.
Either, isn't there Medicaid funding
yeah,
for
yeah,
transportation?
yeah.
But what I'm hearing, what the frustration is, and Taylor may be able to go into this a little bit more because it was one of the committees on the community health improvement plan, but the vendors who provide that are a little problematic and not reliable. And it causes problems with that appointment's missed, and then the next time is 3 months from then. So like I think they need to work on that part of it. Do you want to expand on that too? Or at least that's what I recall here.
From which organization?
So just transportation through Medicaid, because it is
Yeah,
paid,
yeah.
and it was the vendors, and it wasn't particular to Swope, it was Swope, Sam Rogers, anyone who's relying on transportation through that.
There's a lot of drivers who are like, have not been reliable, and so people will order like transportation through Medicaid, and then like it just like won't show up, and so then they get charged like what would have been like a free visit because they missed their appointment, so they get charged more for missing their appointment, and then it creates this whole like
Snowball effect.
like it's almost like, I mean, I understand why they do that because they don't want people to just not show up, but also it's like horrible if something happens, like if they can't get there.
Now, I think during our meeting here, I think their focus is, they're not where they believe they need to be with seeing people here. So one of the reasons we're having these monthly meetings, like kind of retouching base, is to help them to get more people here.
So I think their goal is at least 16 patients every day that they're operating.
So then the two things would be marketing and transportation need to be brought up at that meeting.
One of the benefits too is that we are on the bus line, so sometimes people do take the bus and come here, and it's people getting off and walking over, so that is one.
That's actually a good thing to bring up. Where are we in the latest in putting a big major bus stop there? Have we heard anything back on that?
It's very unlikely.
So that's not gonna happen. That was one of the selling points, remember?
Why?
No funding.
So I know
No
KPMG
demand.
is like $30 million, and like they
Okay,
had $30 million cut that they weren't expecting, so I mean, I think also that is one big issue, because now they're thinking about starting to
They're gonna
charge.
start
which
charging again.
Right now, we have a free bus system, and buses and transportation, all of it is free. We're talking about starting to charge for it so that they can sustain themselves, but I think they are planning on cutting a lot of routes, unless they can come up with the money in a short amount of time, which
But-
seems.
The goal was initially to put actual real sit down, cover, whatever, especially like
Nice.
when it's raining or in the winter. That's not gonna happen. That stinks.
Yeah, I know that was even a priority for our neighbors across the street, with the school they had. It was I don't remember the exact cost of having, one of the full covered stops, but I know we talked about it. An expansion of the route to Parkville, which never really came to fruition.
Right.
But, it seemed like the cost of just putting one of the stops up was kind of ridiculous, like $200,000 or $300,000.
Wow.
And then the annual maintenance that goes into just
Right.
picking up trash and things like that.
They'll need a trash can, they'll need all that kind of stuff.
Yeah.
So is this something that we need to go to one of the city council meetings and beg and plead?
Well, we can contact our city councilman.
Yes,
Still, you gotta convince everybody else too, though.
I think our city councilman is someone who we can count on if we have a deemed need up here.
I mean, I think that's going to be the tough part to prove for the number of people that would use it.
yeah.
Our
Again,
numbers would increase, that's what I would tell them, if we would actually have access to get here. That's how I would support
well, we've got the issue being, we need to make sure we're meeting the needs of all the citizens of Black County, remote, rural, and
it. Kansas City itself.
Kansas City itself. And what I'm hearing is transportation is an issue. I think the telehealth, Medicare, Medicaid has been extended another year. Is that correct?
I don't know.
Telehealth has been.
I think so. Having said that, I think that as a board member, I just want to be sure that if we are aware of citizens who are needing evaluation services that could be done remotely, that could be something that SWOPE can engage. And then if we have transportation challenges where a physical evaluation was recommended, there certainly can be some outside the box thinking, because if these folks do have Medicaid, we can try to find the local Medicaid provider closest to them to perform those evaluation and management services in conjunction with getting them I think our role could be get them plugged in to make sure their needs are met. That's the only thing that I'm kind of focused on is, do we have unmet need? How can we most efficiently meet that need? And I don't know if that's a problem or not, but if it is, there's certainly elegant ways to skin that cat.
So from the VA, as I say, how does the VA do their transportation stuff?
They are really struggling right now. For one, they don't have enough drivers. The need is out there, but they don't have them hired. The other thing they use a lot is they use Uber a lot. And they contract with them and they pay them to pick up veterans. And that seems to almost work better than using a van of some sort to drive around and pick people up. And that's been more successful. And I think the patients have had better success in getting to their appointments in a timely manner using Uber.
Does
We
Medicaid
have-
reimburse Uber?
Oh, we do have Uber. We have a lot of patients that do use Uber.
Does Medicaid pay for it though, reimburse it?
I don't know if weren't involved in that if they do. The other thing, to Dr. Chaffee's point, we also, Dr. Parker had a pretty good patient base that was using telehealth services. And I mean, patients that loved the telehealth services and probably are struggling at having to give that up. So I don't know what those patients are doing. So
We just, in practice,
and I don't know
and
if Swope is
actually
offering
in
that
our
or not.
clinic, we use telehealth at the VA quite a bit. I mean, still do.
It boils down to, are we aware of a need in the rural areas? If not, have we looked, what constitutes looking that's adequate, that we will feel we're fulfilling our duty? I don't know if that's, I'm not making any kind of motion, it's just a discussion item. But if we want to be the best health department in the state of Missouri, we have to think along those lines of what are the challenges for those who geographically have difficulty getting here? Can we work with SWOPE to find the way that they can be reimbursed to do telehealth visits, or assess? Are we talking 20 people in the county who are having challenges? Is it 200? I don't know. But I would be very supportive of making sure that we are assessing the geographic challenges for some of our potential patients who need to access physically here. And if it's seeing if SWOPE can do some telehealth evaluations for people who aren't already plugged in, or some of the staff can meet with these people virtually and assess if they do have a payer source, directing them to the closest place so they can get the care. We don't have a monopoly on providing care here, but I think we should have the monopoly on pointing people in the right direction and facilitating access.
So I did just double check and verify. Swope does offer telehealth services
Great.
for that, and they just request that whenever they make their appointment, schedule that. So that's service is still being offered.
So every person that calls in, that is offered to them,
Mhm.
so they're aware of it.
I'll do check, make sure I don't know if they're offering it, like, cause like they have a direct line that where they go through and call to make appointments. It doesn't come to this clinic. It's just a 1-8 number, and that's where all appointments go through, but telehealth is an option that is available for
Okay,
the
as long
patients
as
there.
the patients are aware of it.
So, but and that's something we could do to work with on like social media campaigns, let them know that's an option too.
Is a potential adjustment to the webpage or in SWOPEs or somewhere to let people know that, well, I imagine they call in, and if they can't physically get to them, they'll set it up. So I'm just trying to make sure that we as the board are encouraging evaluation for folks who, making sure people who have needs get to our website, get to their website, or when they say, I need help, we have processes in place to try to meet those needs reasonably.
I'd be curious what their process is for that. I know with our clinic, we have a process of big triage,
Yeah.
whether it's something that I physically need to see her.
I think these are great problems to have. We're trying to find ways to serve people better, more efficiently.
So one thing we could offer is, and I don't know what's on the agenda for next month, but we could certainly have SWOPE come in and talk to the board.
That
I
would be
mean,
great.
they are trying to work with, I mean, we started these new meetings. We've only had one, right, Dustin?
Two.
Two? Did I miss them? I wasn't
You're
here.
you're out of the country.
But,
Typical.
Yeah.
but, so I've only been to one. I guess everyone else has been to two. But the focus has been, how do we get more people here, get more people connected with the knowledge of the
And I think
services.
we've talked about this before, about having SWOPE come in.
Yeah, and
That
we
would
can,
be, that would be good.
They've had time now to know, to feel the situation out, what challenges they're having, how they feel about where they're at. I think that'd be good to share.
Yeah, it'd be interesting to know, they might already be serving a lot of Platte County residents through telehealth, and we just don't know about it.
can you,
Check your Brandy and Dr. Jamal.
And as for marketing, I don't know how you guys feel about this, but maybe you could do a couple billboards and do a joint Platte County advertising and SWOPE on the same billboard or something, and share the cost or something. Just let
I don't know
everybody
what
aware of it.
something like that costs. But that would
Yeah, I
we
don't know what
can
it
look
costs.
into it. We do a little bit of billboard stuff with a grant for WIC.
be- Okay.
It's typically, what, once a year that we do that. But it's not cheap is probably the
Yeah.
issue, but we can,
$4,000 a month, right?
I don't recall how much it is.
I do.
But if our numbers are going down, obviously something has to change. Whatever that might be.
I think the numbers transitioned down as we went through the transition, if I'm correct, and that a lot of these folks found a healthcare home at one of the other SWOPE locations.
Yeah, like at Maple Woods and Riverside in particular, I think.
But I'm trying to look at, are we adequately going through the process to assess the needs of folks who aren't aware? I don't know that there's an answer to that, but it's something that
That was my kind of thing that I was thinking about when we were doing the strategic stuff was, are there patients or individuals out there that they don't even know how to get to this? And just because we're this rich county,
Right.
I think there's more people out there that may need our services and we just don't know how to get to them.
Or they don't even know we exist. That's the-
or how do we assess that?
Yeah, how do we assess that? Yeah.
I really think social media, you know, and well, we've discussed this before, YouTube videos,
Yeah, how much
People
is
watch a lot of YouTube
social
videos,
media
don't
thing
they?
cost? That's probably way cheaper than.
What a great problem to have that we are trying to find people to serve.
Yeah.
That's what our biggest focus right now is, are we doing a good job or not? I mean, I think it's a wonderful problem to have. I'm not saying we're not doing a great job.
So-
I
But maybe
wanna-
we need to hear from Swope too on how,
Yeah.
And
because
I
I don't know what they've all, kind of done.
One of the things is getting people who qualify for Medicaid signed up. And we currently have someone from Slope here
Yeah, that's
every Wednesday and Thursday to sign people up and get them signed up.
8.1% of the citizens of Platte County, according to my research I did today, are uninsured. And there's a preponderance of, what's the best way to say? A lot of that has to do with certain demographics and or ethnicities. Was the only weakness that I was able to find. I used an AI tool to evaluate how we're doing. And it took me and I have printout reports of it. I spent 5 minutes and I had some impressive documentation on it, which is what spurred me to say, how do we know we're doing okay there? And we certainly have access, and all that somebody would have to do was go to our website and they will be able to make a phone call, send a text or an email or something to say, I need some help. And I have every confidence that they'll be taken care of. But as a board member, I feel part of my role is to say, how do we know that the folks in the remote areas are getting adequate coverage? Some of them are covered by senior services in Platte County, some other items too, but it's a question to say, are we doing good with the rural things?
So Taylor, do you want to talk about the community health assessment and the CHIP priorities and how that ties into this?
So previously we had access to transportation as one of the main community health improvement plan, one of the goals. We realized the way it was worded was just very broad and very open, and there was, we can't change the whole transportation system overnight. So we changed that third one, and we changed it now to access to care, with one of the objectives under that goal focused on transportation and access to transportation in relation to healthcare. So that's one of the things that we're planning on doing. We're also planning on doing more things that are social services, connecting people with resources. 211 is a good resource that is provided by United Way, and they have anything related to transportation, to education, to any of those social determinants of health in the Kansas City area, and they constantly are updating it. So that is one really good resource. I think that part of their issue is just getting the word out there, because I don't know that everyone knows about them. So we were also talking about helping that. We also just working to connect those people with different resources. We're finalizing the new CHIP
So
priorities.
what are the 3 CHIP priorities?
So it's access to healthy foods, access to mental and behavioral health, and then access to healthcare. So those first 2 are staying the same, and then, like I said, the transportation is changing to be more of an emphasis on accessing care.
And that is doing all the stuff that you just said, Dr. Chape, looking at the zip codes and census tracts
Okay.
that need.
I'm not trying to make more work. I'm gonna make sure we have a process in place
But
that's assessing,
I'm surprised Taylor didn't say, hey, we're doing that. But that
It's
is
the beginning.
part of that. And I think if we're going to put billboards, we need to put it in those zip codes and those census tracts. One of the things that's not too expensive, but depending on the audience we're trying to reach, there are people, and I'm not cool enough to know, but streaming music, some of that has ads, and you can actually target it to specific areas. And we did that when I was at Independence, and we got people to events that we would have never reached if we hadn't done it that way.
It boils
Because
down-
they listen to music and they listen for the free version that has the ad.
Yep. That's
We've
cool.
got 9,120 people according to current statistics, with a current population of Platte County is 114,000 and change. If we have 8.1% uninsured, that translates to 9,120. And I think as a board, our duty is to make sure they're aware and it's a choice that they're making, not a lack of information, quandary they find themselves in. And what it sounds like is we have processes in place. I'm not trying to create more work or headache for people. I'm just saying, we have a process in place by which we can make sure.
Well, I think we are working on it. I
Sounds
don't
great.
know that it's totally in place, but I know just even, so Dustin mentioned Jill, our new marketing specialist. And, you know, she has all kinds of ideas for the website to make it, she's working pretty hard, I think, to get it more user friendly. Right now, it's kind of hard to navigate, and we know things should be like at that 4th grade level. And basically, if you go to our website and you're just frustrated and can't find what you're trying to get a resource for help for, you have a tendency to just give up. And so we need to make things really accessible that way, social media, all those types of things to reach people.
And I'm curious too, how these statistics were obtained. How do we know somebody's uninsured and doesn't have means? Or is it a bunch of college students at Park University or Maple Woods who are choosing not have coverage because they don't think they have needs? I don't know. Again, maybe I'm trying to overshoot our
Well, I
improvements.
think that data is stuff, I know we have looked at that before. I don't remember it off the top of my head. Dan probably does, but we won't make.
No, I'm not.
those.
Nobody needs to be put on the spot. As we go through this process, I start thinking, how do we be the best? Are we making sure the most vulnerable and weak in our county have enough knowledge to access the services that they're all paying for?
Yeah, so I guess to answer your question in short.
We don't know.
Out of all the things that we could have chosen as priorities for the community health improvement plan, the thing we're talking about is one of the 3.
Great.
And I think that came up a lot in the surveys and when we did the community health assessment and then some of the focus groups and forums.
This board is supportive of all that.
And I don't know
I
if
could
you
think
all
I could.
remember, but I
Yeah.
talked about the incentives that we had done for the surveys that Taylor had been
Right,
going to
yeah.
different places. So that's where some of our information is coming from too, like very personal, firsthand knowledge from Platte County citizens.
Sorry to hijack the whole thing, but I figured it had to be said, so it sounds like this is fruitful.
But Dustin will arrange for Swope to come either next meeting or the.
Yes, that would be great.
That'll work.
I think that's the beginning.
All right, let's move on. I didn't mean to kill the time here. Sorry about that, guys.
Dan's like, I don't even know where I'm at.
He's done.
Continuing on with Swope, they were able to give us some of their survey results. So they asked a series of questions and then we had like 15 who had completed them, but all of them were rated.
Hold up, you're kind of going through this fast.
Oh.
And this is kind of important because for months, I have heard people say, what have we heard about the patients getting
The
care at
satisfaction,
Swope?
yeah.
Right.
And, yeah,
And
it's 2021.
I've had nothing to answer. And at this last meeting, my first one, everyone else's second, we actually had info about what the results were. So Dustin, if you would walk us slowly through these, because I think it's pretty interesting.
So yeah, so we were discussing with them. They did submit them. I don't have the original copies because it had patient information on there, but
Your summary was excellent.
I was able to break it down, what the questions were, how they ranked them, and as you can see, the vast majority were rated at the very highest for it. Even their lowest was right there in the middle, and that was only a very select few. So they had an overall really positive experience that they're receiving from their clients, which normally if you're gonna have someone fill out a survey, it's the ones who are gonna complain, and usually you get those real big negative ones. So the fact that the results are coming up positive is a really good sign for them.
And I think Dr. Kingsley asked me, who gets the survey? Is it only the people that they think they did a good job with? Or is it
Skew the
everybody?
results a little
I
bit.
assume he was joking.
No.
No.
That's a joke.
You
But
can
they give,
easily skew the results the way you want it. That's
but they give it to everybody.
Yeah.
Just in case you're wondering.
And
Although I
Dustin's
thought
right.
it was hilarious when he said, do they just give it to the people that look happy?
But Dustin's right. We've actually, where I work, when we give out surveys and stuff, sometimes people are like, those guys are mad. Don't give them their survey.
Yeah, that's very true.
They're the ones that have no
Very true.
problem giving you their opinion. So yeah, so overall, like the results really great. And then as you can see by some of their comments, some of them were kind of skeptical at first. Change is hard for anyone. I know our family healthcare was here for years, and our patients really bonded with our staff. I know I bragged about them, Andrew bragged about them. We give out some of the best care and have some of the best employees. So why wouldn't they be a little on edge about trying to get a new provider? But once they came in here, saw that Zara and their team are really, really great. They're responding really well to them. So it was really nice to be able to have the results and see that, our clientele do think really highly of them.
And they will be providing this to us monthly.
Yes.
Here on out. So it won't be a surprise. I will say, I was listening with bated breath. I had no idea what they were going to tell us. And so I was pretty happy when they said, what the numbers were. And I'm like, oh, these are all really good.
Mhm.
And so that was very good news for me to hear. I was very happy. I'm not sure exactly what happened, why it was taking so long to get some of this feedback, but we were assured from here on out if it's in the process, then it won't be a problem.
Yeah. So to answer that question, they have their IT builds it for each individual location. So I just took them a long time to get everything coded into specifically for Platte, Platte County. So, and then they didn't have a lot of responses that first month that was operational, but then now we're starting to get some. So,
and these surveys are going to people that come here as well as Riverside, or just your own?
These are just for here. So these are just, like I said, each one's tailored for every single clinic. So this is everything that's
But they separate them out.
Because I'd be curious to see what the survey results are for Riverside compared to us. Just curious.
I can ask them and see if they'd be willing to do that. So.
Because that place has been established for a while, right?
Yeah. As far as my room report, so we've been partnering a lot more with health education. You can scroll up a little bit, Dan. So one of the exciting things we've been doing, other way, so we've been partnering with health education, doing a lot of different blood pressure checks throughout the community, and we're pretty excited because right now they've been working on some curriculum to go in to give to different organizations, primarily long-term care facilities, to help teach them how to best monitor their blood pressure for anyone who's got a caregiver. And they'll be presenting that here on May 2nd at a conference. So we're very excited to be able to be doing a lot more things down in the community, and then Trisha and I are very passionate about trying to combine our two divisions and getting out there and doing a lot of really fun, innovative stuff. So that's been pretty exciting. I know we had a huge turnout. Carla, I've been having her go with them because she has that cardiac ICU experience. So she gives them all sorts of wonderful experience and knowledge that they probably didn't know they had. We've been doing our annual TB case management and investigation classes, as well as a 2-day STI intensive. We finished up all the rest of the back to school clinics. WIC is having a pretty busy month. They actually were able to start going live with their eWIC cards. So that'll enable anyone to get their cards refilled digitally. That'll be official for everyone starting in this next month, but they're able to start distributing those there. So they're pretty excited. We mentioned last month about how we had the WIC biannual review. We got the notes recently. Again, it was a lot of little cherry pick things about you had to make a notation here, dotting your T's, dotting your I's, crossing your T's throughout that. But we are working on an action plan. We'll be sending that out to the state here in the next couple of weeks, what our plans, how we're going about making these changes, and various things like that. And we are working on planning on a prenatal baby shower that we'll be hosting in the WIC clinic on May the 6th. So they're working on getting some pretty good prizes for that too. So we're pretty excited. I did do a little preliminary for our STI clinics back in September. You guys approved doing 0 testing fees for the STI clinic. Here are just a little bit of results. So overall, not a huge change in the number of people coming in for STI testing, but one nice thing is we are seeing a decrease in the people needing treatment. And we also have noticed a difference in like the days people are coming. So previously we had the STD free testing Friday. That's when all of our patients were coming in. So Monday morning, the nurses been bombarded with phone calls, looking at results, trying to call people up. It's now dispersed throughout the whole week, so that burden's been kind of lifted and kind of helped things out a lot. But
When the people come in to get tested, do they get any counseling, or is it totally anonymous? They
yeah.
come to test. So do you think the
everybody.
counseling is what's helping decrease the STD rate?
We've always done the counseling with it, so but maybe yeah. I can't really give you a good clear answer of why the need for treatment's kind of gone down. I know overall STI rates are kind of going down throughout the nation, with the exception of syphilis. We're seeing a lot more of that, primarily congenital syphilis. But yeah, we do try to tailor our, and that's part of like one of the big things from that 2-day STI intensive is like how to communicate to patients, providing them with lots more education. So.
Is there a thought to do some HPV testing as part of the screening, given it's the most common STI
out there? Yeah.
We could look and see what the cost of an HPV screening would be for test. I'm just something we've been trying to do is like offering HPV vaccination whenever clients come in, just to kind of help capture it, because they did expand it to up to age, I think 45, like the maximum you get for it.
I know there's no significant treatment, am I correct?
Right.
For the HPV. However, folks who are positive would be benefited by having more frequent surveillance for adverse outcomes who are positive with it. It's just a thought.
Yeah, and I do know that they're here recently. I think it just got the approval within the past few months. There is actually a home test now. They are offering for HPV that you can just have a picture home and test that way. But I guess something we can look to as well and seeing what that would be. That's all I have for my report. If there are any questions.
Just make a note to look at that for next month.
Yeah.
Just how much it would cost and whatever. Is it something that's reasonable?
One of the presenters yesterday brought up, and I'm not, definitely not a subject matter expert, so I was kind of understanding some of it, but not all of it, but access to more pre-exposure prophylaxis that I think even a couple of doses of doxycycline that may be helping with some of the syphilis numbers. They talked about the way the HIV numbers kind of trail the syphilis numbers by a year or so. So you might see a decrease in the syphilis numbers, but the HIV numbers might still be going up. They haven't started going down yet. It was kind of interesting from more of a layman's point of view to hear what he had to say, but I'm sure you would have a better understanding of what he was.
Yeah, the prep with doxy is something that's been kind of mentioned at the state level, but it's something that they don't have the funding or recommendation to be doing right now, at least for the state funded medications that are provided for it. But it is something that they have been kind of monitoring and seeing if funding opportunity comes up for that, and then how that would kind of work with them like in our realm.
Taylor?
All right, well, everybody's pretty much covered all the stuff I was gonna talk about.
Saved you a lot of work. You're welcome.
Yeah, we've been trucking along with accreditation documentation, so we're at 16%. It's one of those things that kind of, some things, like I've mentioned, are huge and some things are small. So like we have been working on our strategic plan, our quality improvement plan, workforce development plan. We have committees for each of those. So those are some of the bigger lifts that we're working on right now. And those will really help once we get some of those done. We already talked about the strategic planning retreat. We've also been updating policies and procedures. So we've had a lot of people creating policies for the different divisions and updating those. Dan sometimes wakes up at 2 a.m. and writes like 30 policies a night. He's been working hard on them, and I know
He's like, I'm not coming in because I was up till 4.
Before you go up any higher, go back down just a touch. So we have until December 3rd, right, of this year. So what happens if I'm hoping we get ahead of schedule, but let's say we don't make the deadline, what happens to us?
so you can request an extension. I think it's like for 45 days. So not a long extension.
So are we gonna get close to 50% here, pretty close, pretty soon?
I don't think it's going to actually work like that. We are working on a lot of things concurrently, and until we actually finish it, it doesn't go on the checked off board. So it's going to be, most likely, we're going to be working concurrently, and like
Then all of a
3/4 of the
sudden-
way in, we're going to be like checking a whole bunch of
Yeah.
stuff.
Okay.
And same with like the CHA and the CHIP, because we're also doing a lot of stuff for that, through the Northland Health Alliance. So those are like the big chunks, and then there's lots of other things that are related to individual people. So I think now everybody knows what they're doing with doing the documentation. So this is just the one that are completely ready to go. So they have whatever the measure required. There's kind of like an introductory form for every single measure that you have to fill out that explains what documents are. You have to go through and highlight them, show how it meets the measure. So this is just showing those that are completely done. So there's a lot that are like almost done, but we just have to,
Right.
you know.
And then some of it, like on policy and procedures, we only have to have certain policies and procedures for accreditation. But then we know we need to really work on our whole comprehensive policy and procedures manual. And because Dan's leaving and taking so much knowledge with him, it makes sense for him to like download, regurgitate everything he knows into, our policies and procedures before he leaves. So that's like just some of the things we're trying to do that are extra, they're time consuming, but apparently we can't do them next year with him. So we need to use him while he's here.
Right.
And so that's not really delaying anything, it's just extra work on top of the other things we're trying to put forward.
It's just, we only have 7 months. That's gonna go fast.
Yeah, it is.
Oh, and what happens, you asked what happens if we don't meet that deadline? My answer is Taylor will be looking for a job.
Oh,
Lay down the collar. Yeah.
Wow, no pressure.
that was tough.
Wow.
No, the team, I mean, some of this is not the most exciting
Yes.
stuff ever. And so I think
Sure.
everyone's working really hard, like the policies is one thing, like Dan being so freakishly like in tune to cranking those out. That's awesome. Some of the stuff, we're not all like Dan. We're like, oh my gosh, we gotta do X thing. It's not very enthralling, but strategic planning, I was concerned because part of the presentation was really dry. I did not think people, like some of our people would want to know about a SWOT analysis and different things. But I would say I was quite impressed with the team.
We get a lot of feedback.
Right. That's it.
Any other questions? We already kind of talked about the CHOM shift and all of that.
So probably Susan, do you have anything else you want to talk about?
I think we've already talked about kind of the finance too. We met Tuesday, April 8th. And the majority of the meeting, and Dr. Shafe was there too, was on the banking services and looking at all the 3 proposals that were given to us. And then the staff also gave us an update on the Paylocity and how pretty much I think it's just working on time cards right now is the main part of it, but there's a lot of things to build with it. So it's going to be a process that takes, we had all these ideas and, oh my gosh, we're going to have this and people can get on it really quickly and do their in-services and all that has to be built into it. So once it gets done, it's going to be awesome is how the staff feels. But at this point, it's an ongoing process.
So do they have like IT people that assist with implementing all this stuff, or how does this actually work when we?
So
implement
they will train us to do it, but we will
it?
actually.
Will they have
do
somebody
it.
here though, or no?
What's that?
Does somebody come here to teach you, or what?
It'll be online stuff
Online.
that they'll teach us.
Okay.
But Dan and Taylor I think that's her name.
Hi, nice to meet you.
Are working with a doctoral student whose thesis is basically on helping us create a curriculum for all of our staff.
Oh,
So
that'd be
all the
perfect.
things that they need. So we're outsourcing some of the like finding the classes and stuff, but we'll be putting that into the Paylocity system. And a lot of the trainings will be video trainings and different things. So like we want to do sexual harassment training, but we want to do that every year. And we'll just be able to put that in and it'll come up
Yeah.
automatically that you
You're
have to
due.
do this
Mhm.
and the tracking will come back, you know, Dan will never do it. So Andrew, you need to go tell him he has to do it. So it'll be really streamlined. Cindy probably can speak to it a little bit. It's difficult, I think, being the size we are, we have enough people that it's a lot of work, but not enough people to assign someone to do
Right.
things like just track all the education. And so we're pretty excited about putting those types of requirements in and actually getting people the training. And as it turns out, it happens to tie in exactly with what we're trying to do in the strategic plan. So things are really like some of the things we want to do really tying in with what we're already trying to do and for multiple reasons.
And this doctoral student actually worked for Clay County Public Health Center, so she has experience in public health. She's currently a associate professor, I think, at the UMKC, or I'm not sure. Yeah, but basically a public health instructor. So
Okay, awesome.
very good resource. We will take full advantage.
The hospital I worked at, when they implemented a new computer programming system, they had techs that were there to sit by you and they do templates, right? Those are like quick shortcuts, makes the process a whole lot easier. You can do it the long way, but then there's all these little inside baseball things that they can do to speed up stuff for billing and whatever. So I don't know if that's the case with these guys or not, but I would see if there are templates that you can put in that just expedites the whole process.
I think there were for
Yeah.
some areas, but I think what's the hard part is you have to define it for your institution,
Mhm.
so.
And
but
tailor
they're
to what you
tailored
want.
to you what you want.
Yeah.
So they had those beginnings from what my understanding was, but it's just.
And we're currently, they've done the data extractions from our most recent payroll, and we're waiting for that to load. Once we can get some data actually loaded, so we can start seeing and what we're actually going to be seeing, it'll start making things click for us. Right now, we haven't seen any of it, so it's all, we're still just.
Theoretical, and it's kind of hard to envision when they're talking in theory
Mhm.
and you can't touch and do it because we know it has to be exact. So we want to be able to touch it.
When do you want to implement it? When do you want to start this whole process?
Or middle May.
Middle of May.
Then so actually the first payroll will be the middle of May. So we will start using the time clock function
Last week.
in a week and a half.
Are you going to overlap the old way with the new way at the same time, just in case there's any
We
bugs?
won't be doing mirroring.
You won't. Because that's.
They are confident that it's going to work and as we were onboarding with them, they said it won't be necessary.
All right, well, we heard that too. There's no bugs. This will be easy. There are tons of bugs. Just saying, just be careful.
Not a problem till it's a problem.
Yeah.
As long as Taylor doesn't get paid twice.
Oh, that would be wonderful.
First, you're gonna get fired, now you get the raise.
So financial report and nothing from Cindy, so need to review and approve the bills.
I move that we pay the bills for this month.
Second,
I'll second that.
discussion. Susan,
Yes.
Yeah.
Yes.
me, yes, Mike.
Michael, yes. Yes.
Okay.
Fee resolution, Cindy?
We had actually one increase this month. We had a lab fee for Platte and Gold, went up from $60 to $73.
That's TV, right? Okay, it's a necessary evil, right? Yeah. So I have to make a motion?
Yep.
Anybody want to make a motion?
I make a motion that we increase the payment for the TV screening from 60
60 to 73.
to $73.
A second
A second,
for discussion. Susan?
yes.
Yes.
Lee, yes. Mike? Michael, yes. Zach?
Yes.
He's kidding.
So Taylor, I think we beat the heck out of the
Yeah, I know.
strategic planning. So unless anyone has any questions, when is she going to be coming?
To the June meeting,
So Taylor will be coming to the
18th,
June meeting.
the Wednesday. The one that we moved from the Thursday to the Wednesday.
I'm out of town. I'll find a way.
Online. You're gonna be in Europe, aren't you?
Oh, great. Now everybody knows. All two people that were listening.
Oh, I'm sorry, is it a secret?
No, it's a family trip, my wife's side of the family, so I really have to be there.
We're gonna have a party at your
I will
house while you're
Find a
down there.
way to participate.
So as most of you know, every year we have to provide a annual report and attached you have a draft. There's been a couple minor changes since we put it in the packet. The pages aren't numbered, but on this page that says 558 food inspections, we added some other numbers on the side that just kind of indicate how many violations were corrected while we were there, how many non-critical violations we observed, and then how many critical violations. And critical violations are ones that lead directly to foodborne illness. So food being out of temp, or maybe being past its due date or whatever, but something that could make someone sick, a dented, exploding pan, whatever it might be. The things like a chip in the linoleum on the floor typically would not directly lead to foodborne illness, but it's a sanitation issue we're going to address. It just isn't something that's going to make you sick. Hopefully.
And this is like, stuff like this, that's perfect, like for
It's beautiful.
this is gorgeous all the way through, but it's just like for the public to kind of see, I mean, people love about food inspections. That's just something that the public are like, oh, well, what are we doing in Platte County?
So this is a little bit different than previous reports. But Jill Ballard, who is our new marketing specialist, put this together
This is-
with
Yes, I
her
love it.
boss, who is Trisha Rothweiler. I think some of the health education team. I think Dan had a hand in it. He probably did very little. Sorry. But it was a team effort because she came in pretty much, 6 weeks ago and had to learn what we're doing. It was a pretty good learning experience for her. I think Taylor was helping with this. Dustin was unhelpful, like Dan, but yeah, they did a very nice job. It looks great. I
So if we
agree.
put this like on our website?
Yes.
Yeah.
All the annual reports, so you can actually go on and see back to 2021, I think.
Okay.
Make sure
Yeah, I
the
love how
county
this
commissioners
is-
get a copy too.
I'm gonna apologize. Dustin, in your report, there was a mention that you had attended, something on mental health, the Northland
Oh, yeah.
Care Access.
Mhm.
I had made a note to ask about that. It's just, tell me what's going on with that.
It's one of the task force that basically that Taylor spoke about earlier. So, access to care, mental and behavioral health, and then healthy food. So it's just a task force that we're working on trying to improve access for.
And that's with Beacon Health, Northland Healthcare Access.
Mhm.
Who else was it?
It's
Center.
all of the hospitals in the area.
Right.
So
Several organizations are partnered.
it's an evaluation to come up with some data and findings that are objective.
It's probably more looking at the data that's out there.
Okay.
And looking and strategizing how to connect people to services.
Okay, thank
Some
you.
of it is evaluating, part of the evaluation was done more in the community health assessment side of things. And now the community health improvement plan part of things is trying to create initiatives to kind of use your example. It wasn't for mental health, but you said how many people in the community need a ride or need access to care. So that's in the assessment part.
Okay.
How do we get them there? That's in the planning and implementation part, if that makes sense.
Thank you. Thank you for indulging me.
Yeah, so most groups are working on like finalizing their plans for what our goals are and how we're going about trying to accomplish those.
Access to mental health.
No, I saw it was a task force and for full transparency, I wanted to make sure that the methodology of any conclusions that this task force arrived at were based upon reproducible, good data, because we did the children's mental health evaluation, and believe it or not, the AI algorithm, the AI bot I used to evaluate Platte County gave us kudos for having that listed on our website, and it was a proactive step that, yeah, so we are being proactive, but any conclusions arrived at by a task force, I wanted to make sure that the methodology was sound and that we're making data-driven decisions. That's it.
Do we assist in access to mental health services? Can we actually say that?
You know, no more than what we really have had, like what
But we have tried, not, well, whoever it is now, Beacon.
Beacon.
We have that.
Yeah.
So we have the services provided. I mean, that's another thing we could put at the back, public health services is assist in access to mental health services, if that's what you want. Just to say that we're doing our part or whatever.
I just want to make sure that there was good data upon any conclusions that a task force would arrive.
Okay.
This was more internal than I wasn't as worried about this.
It just made me start thinking again about what a great report it is, and then I remembered that I had a question, making sure that a task force wasn't going to come up with some conclusions that weren't necessarily vetted in good data.
No, but taking all that data that they collected from the community health assessment and like making a plan. We're gonna go about trying to improve like the health. So I think the big priorities are, like improving access to care, reducing deaths by like suicide, substance abuse. That's a pretty big one. And then when they're trying to gather more information they don't have a lot of info on is like abuse for like domestic partner violence. So it's one they're trying to see how they can kind of capture some of that information and try to help improve some of that and make awareness more natural out there.
Thank you.
So when does the official report go out?
Well, we actually need the board to approve it,
Oh,
and then.
make sure there's no typos.
I'll make a motion to approve the 2024 annual report as submitted at this meeting.
I'll second that.
Okay, any further discussion? Susan,
Yes.
Yes.
me, yeah.
Michael, yes.
Zach?
Yes.
So you all made Taylor very happy because she was waiting for this. She is, her and Dan, I guess, are submitting a grant application to the city of Riverside. I think you all may realize every year they give us $15,000. I believe 10,000 of it is usually provided to the back to school fair where we help with backpacks and do back to school immunizations. And it's a big event we've had here for the past 2 years, but that grant is due on Sunday, I think Dan said.
By Sunday.
So
Had it ready to go, except for that.
So
Ready
now-
to push it.
now it's ready to push send.
Just make sure there's no typos or something that we missed. I don't want us to look like idiots.
We looked at it several
Oh, it was you.
This thing has been gone through, I mean, you always can miss stuff, but
Right.
we have gone through it. Dan's like, I don't want to go through it.
Dan has every page memorized.
Well, and after a while of looking at the same thing, you quit seeing it.
Yeah, sometimes you have to put it down,
Yeah,
step away for a while, and come back, get fresh eyes, yep. Okay, I like it. I think it's visually
Yeah, it looks
stunning.
great.
It sticks out and bites you in the rear end, that's for sure. So I like it. Okay,
She did a good job for sure.
And I know you guys, I think Susan mentioned liking this page. I feel like this is like very like health literate. So we're trying to move in that direction of doing more health literate type things.
Yes.
using plain language where it's like simple but visually
Yes,
pleasing, where it's like,
yes.
okay, you can see what this is, but you don't have to read like paragraphs and paragraphs. So
People will look at that
Yeah, yeah.
it's less-
They will, yes, they will.
Jill did a
So
great
you
job
kind
on
of
the first time,
have
but-
stolen my line, Susan, because that's what, when you talk with staff, I'm like, people will look at that. They are not going to
Sure.
read this.
Yeah,
They
No.
won't read this.
No.
But they will absolutely look
Yes,
at
they
that.
will.
And
This
so
looks
I think we
Very
are,
professional.
yeah, we are making some great changes, I think, overall, just being really, really sensitive to what we put out, how it's going to be received. Not to say we haven't always put out good information,
Oh,
but
no.
sometimes it just has been a little overwhelming, I think. So the team's doing a great job. Financial disclosure.
I read that one 3 times.
Oh, we maybe are.
So this is just something we have to do every year. Do you want to walk us through that, Cindy? Or is that not you?
This
It's
is.
the other Cindy? Okay.
Let me jump in because you all may or may not be aware that the Missouri Ethics Commission does send us, and we have to file with them.
Online.
I
I did
believe
mine.
it meets this.
Right, but we still have to pass this resolution.
Right, no,
Okay.
it makes sense.
Right.
But I was trying to make sure that this is the time to also say, what, if anything, does this resolution require us to do in addition to what we're doing?
Nothing.
And that's just making sure. Okay.
And I have to fill one out too. So it's like, we basically are just, this is saying we all agree that we're all going to do this and you're going to make me do it.
Has everybody went online and did it? Yes? Everybody good?
I need to do it, but
Okay.
Yeah.
Eric,
To the
yell at him,
video
then.
later.
Yell it up.
But, well, you have to yell at them.
Oh,
I
come on,
can-
man.
yeah, he goes, man.
Yeah.
It's full transparency that none of us are improperly allowing
Yeah.
ourselves or relatives
Mhm.
to benefit inappropriately. And
With
that,
our big salaries.
Yeah.
Yeah.
Yes. Yeah, no, I'm aware.
It's tax
Sorry,
season.
Susan, do it. Take your time.
well, for example, I'll point out, for example, we're gonna be opening a clinic on North Oak for urgent care May 5th. If for some reason the county wanted to get their Ahmed done there, I would have to disclose I'm XYZ% owner. I would recuse myself and I have no issues. I think the rest of the board members and the rest of the team know that I will always be very proactive in spitting stuff out that may have any semblance of a conflict. But this is codifying it and I love it.
I'm drunk with power and the money from this position.
I would make a motion to accept the financial disclosure resolution for Platte County Board of Health Center trustees and the executive director.
A second.
Seconded.
Any further discussion? Susan?
Yes.
Yeah.
Yes.
Me, yes.
Michael, yes.
That-
Yes.
I think we were.
So
We're
the
we're
next
like
one-
unanimous too many times. We need to argue about something here.
Well, Dan has a topic and you can just
Yeah,
disagree with Dan.
Okay, all right. Here we go. This could be a good topic to argue about.
yeah, and this is
Nothing
really
really-
for your information, only no action, not any action items associated with it, but just wanted to keep you informed in case you receive phone calls or questions.
Oh, yeah.
We had a food establishment owner recently apply for a permit to sell kava and kratom in a beverage form in Parkville, at a new establishment in Parkville. And currently, the Food and Drug Administration categorizes kava and kratom as if they're added to a food product or a beverage, it's considered adulterated. So we cannot allow the food establishment to add that ingredient to the beverage. Now they can sell that ingredient separately
In the same facility?
in the same facility, and
Person.
the customer can add it to their product after
Like
purchase.
Splenda.
Yeah, we don't have a problem with that.
So,
that's
so
a
my
model.
wife actually works at Jones Mercy. She does chronic pain. So she has patients that use these for chronic pain issues.
Yeah.
So I looked at it and it was more like, it's, like marijuana is like illegal federally, but everybody, almost every state now will allow it to happen, right? So eventually federal, they're gonna have to change the rules.
Yeah.
But to me, this is, as long as it's not hurting people, and as long as the business isn't doing anything crazy with what they're doing, which it doesn't sound like they are, I have no problems with what they want to do with this.
Except the FDA already has a.
Well, I
Yeah.
think the issue for this is we're not allowing them to operate the way they want to, which is they want to prepare everything.
Ahead
They
of
want to mix it all together.
Sure.
And that's where it gets crossed with the food code. And so we're saying you can't do that. You can follow Kansas City's, there's a place like this in Kansas City that does this. And their model is they sell the tea or the coffee, they sell them the kava or the kratom or however you say it. And then they can mix it just like putting Splenda in the coffee. I mean, that was probably the best example. They can put it in, stir it up, and then that is 100% fine.
Let's say somebody had cherry Coke and decided to put St. John's wort in it, what would happen?
Is it John's word an adultery?
I mean, it technically, well, it says it's not shown to
If
be
the,
safe.
it's what the FDA says.
Well, FDA doesn't do anything with St.
You
John's.
needed somebody to argue with you. I
Okay,
am.
thank you. So it's a supplement, right? I mean, they could argue that these
Well,
are
there
just
you go.
supplements.
Yeah, I think it's what, and I believe the terminology they use is generally considered as safe. I believe that's right, but, so with, I think the jury's still out a little bit on kava and kratom, so, and this very well could change in the future, I
Right.
don't know, with FDA's definition, but, and the courts have been involved, and it's, so I think the product has, some stimulant effect in lower doses, and then it
So
can
does red,
have some.
right?
Right, but it can have some, again, higher doses can have a sedative effect. And there have actually been some DUIs issued throughout the country, people using kratom, so. I think the jury's still out, and then until the FDA makes a determination, we have to go by what their definition says, and what the courts say, that it's an adulterant.
If you're caught with kava or kratom on your person, do you get in trouble?
No,
That's what I'm saying. And what happens if you go over to,
it's not an illegal item, but it's just like also not proven to be safe at certain quantities, right? So
Yeah,
kind of like
you can say that about
people
marijuana.
with like recreational use of marijuana.
Too much
right?
marijuana, you get
Very
paranoid,
sick,
the whole, yeah.
dude.
Alcohol.
You know,
Alcohol, you take too much of it,
So
you
I think
die.
on this side,
But I
so
think we
for
don't
our
know.
kind of thing, it's whether it's an approved food.
Right.
And basically, when we talk, I mean, and we didn't come up with this, we consulted with the state and the FDA both. And they both said, no, this is like food served in a restaurant always has to come from an approved source. And it has to be an approved food item.
Right.
This is not an approved food item. And so just like checking boxes, for us, it's, you can't serve this as in a permitted food establishment.
So now you're there, let's say you're a customer and you brought your own and you're at the place, you can just do it right in front of everybody and
Don't
do it
care.
yourself and nobody
We don't
cares.
care. They can buy it there.
They can buy it there. It can be
And then-
What can't happen is the permitted food worker can't prepare it.
But people are going there to do that, though. That's what I'm saying.
And
After a
that's
while,
fine.
so this needs to be investigated and just approved and be done with it then. If everybody's gonna
Well-
do it anyway.
Is,
Well, or
they haven't
to
agreed to it though,
certain,
or have they?
yeah, at this point, the owner of, the establishment is also an attorney, so, he has some questions about various legal questions, so we, put him in contact with Jen Snyder, so they're working, communicating with one another.
Is this establishment in Kansas City proper, Platte County, or
In
Platte County? Platte County?
Bill.
And Parkville, okay. And how's Parkville feel about this, by the way?
Is it the lawyer that bought our building?
No, but
yeah,
That would be cool.
It sounds like Jen, I mean, the summary was great, that she is working with them.
Yeah,
And I didn't realize it was an attorney who was the proprietor.
yeah,
at least that's what it seems like.
yeah.
Oh, okay.
And I will say that whenever an attorney starts talking to me, I refer them to our attorney
Absolutely.
to talk to them, because I'm not going to get.
Right.
They probably know the law a little bit better than I, not maybe as good as Stan,
Yeah, of course.
but yeah, we are just going to have them have that discussion. We've been copied we're seeing the interchange back and forth. They are wanting to do things, they still continue to want to do all the prep stuff,
Sure.
but, you know,
Yeah, I think the important point is we really want any small business in Platte County to succeed. And we're not interested
Right.
in interfering with business models. We just have an obligation to protect public health, and that's what we,
Agree with what you're saying.
you know, that's what we have to do.
Let them know that too.
Yeah.
We're not here to stop you. We
No,
want to
and
facilitate.
I will give Bailey a lot of credit. She has done a beautiful job of communicating with the proprietor and with Jen, and she really, I think, is a great representative of the Platte County Health Department, and shows us our support.
And he actually approached this attorney or whatever, actually approached us, right, about this? Or did we
Right, he
just search it?
applied for a
Yeah.
permit.
So it wasn't like they're trying to hide it.
No, no.
No,
Yeah.
But also it's a catch-22 because if Platte County signed off on this and someone has an adverse outcome of this, that's cause of action against the county for not doing its job to protect the public. Whereas if this establishment feels that we aren't acting appropriately and doing our due diligence, they can try to get a test case and file a lawsuit, and then we have to defend it. Those test cases will never come to fruition because the judge will immediately say, what was the communication prior? Did you try to work this out? Was it clear? And they'll just give summary judgment to say, get out of my court because this information, FDA and everything else. So it's good that they're going to work through this process, and instead of suing us, they'll try to lobby the FDA to allow this to become a food item. They have a lot of processes to go through for that.
I just don't want the whole wink, 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 nod, nod, nod thing was when people go in there kind of stuff like, you're not supposed to, put this in there,
So
roll
you
your eye.
can-
Well, I think they can openly say that it's like.
you
hey,
can
we're not gonna
openly
put this
do
out.
it.
Yeah.
There's a hidden part of that. It's just because
They
we're
can't-
permitting them.
Right.
The
They
food
can't
workers
serve
can't
it
do
mixed together.
Right.
The food workers can't prepare it for you.
Right.
The reason we're bringing it to
It's
the
like,
board
hey, you turn
is if the attorney doesn't like what our attorney says, they're probably going to be here at the next. And I thought you might want to have a little bit of a primer before someone just shows up asking about this.
Oh, my wife's saying, yay.
Should we let her in?
Well, actually, I told her, I talked to her about this. Hey, Ray, do you want to add anything to this? You can introduce yourself if you want.
I don't think she got her voice, so try again.
Did you hear me, Ray? This is my wife, by the way. Hi, Ray.
Figured.
she's not talking to you.
Oh, no, I'm gonna go home and get yelled at.
Yes,
Thanks a
you
lot.
are.
Anyway, okay.
I'm driving. I'm at a red light right now, so I can say hi, but otherwise I'm muted.
So do you want to give some heads up about those medications? Do you use them in your own work, or how does that, what you know about them? You don't have to if you don't want to.
That's right. It
That's fine. We can move on.
it's moot because
Yeah,
we gotta follow the appropriateness of the FDA. And
Okay,
again,
we can keep going.
And thank you, Bailey, for working so hard on that.
yes,
yeah, thank
Appreciate
you.
that.
nice work, Bailey.
Yeah, she definitely had a lot going back and forth. I think that's the end of the new business. I did want to circle back around one thing from my report. And that is Taylor has talked in the past about our incentive funding. And one of the things for that incentive funding is that our county commission go to training. And this year we got a note that said only one member of the board or of the commission had went. So I contacted presiding Commissioner Fricker, and he actually said him and Commissioner Vanover had both done it like through videos and stuff. He sent me his certificate almost immediately. We submitted that and we were good to go for the commission training. So
Nice.
I just, I think in the past there had been some rockiness,
Not anymore.
and it's just really, very
Send them a
helpful,
copy of this. They'll love to see it. Actually.
very helpful back, I
Oh,
don't know,
yes.
but very helpful back and forth. between the two entities, so we appreciate that.
Thank
I
you.
think I speak for the board and say, we appreciate the commission working to ensure that that gets done and those funds are reported to the citizens of Platte County. So
Agreed.
thank you.
And it's, every penny we can bring in for revenue with a minimal expenditure is really important.
And we've almost reached every measure of that. We have one more agreement, that environmental health MOU that we talked about last month. We got it signed by Clay County, and now we're waiting for Kansas City. They said that they are probably gonna sign it. They just wanted to run it by a few people, and get back to us.
I think I sent them a signed copy, right? Or I don't remember.
No, I
That's
think we
okay.
were waiting for her to get
Okay.
that, but we might hold on it.
Okay.
I think anyone else have anything?
What did you push to the back? Did we already cover what you wanted to push?
Yeah.
And the computer,
The
Server.
oh, you're running the meeting, man. Come on.
That's actually your job. So I did add one more thing at the last minute, and I hate to do that typically, but there seems to be some timeliness concern on this. So we had it in our budget to replace our computer server and backup system. It is currently, we bought it in 2016 is when it began its life. So it's 9 years old. And in the computer world, that's pretty old to have a server. It kind of lays it out, but if it fails, we could have some downtime and getting parts could be difficult, but the replacement and backup system will cost $22,525. It was through a interlocal purchasing agreement, so it has already been bid out. That's the lowest price that we're going to find. We had estimated that it'd be about $15,000, so that was budgeted. We'll be able to find the remainder of the funds from other budget line items, so it won't be a big deal. But we kind of talked about the ELC EV grant and where people had lost funding because that grant was pulled back. We have a public health infrastructure grant that actually Taylor and Dan talked to Nicole Cooper, who's with the state health department. She was here yesterday and they asked her, hey, can we move some things around? Because right now we're paying some salaries out of that. Can we move some things around and pay for the server with those funds? She said we could, then we can bill it really quickly and we'll have expended those funds. Once we do that and bill it and get paid, then they can't take it from us. So that's why there's a little bit of urgency why I brought this to you all tonight.
Well, I think looking at just what you're saying, I think the biggest thing is that the security and compatibility says it's not compatible with the latest software.
Yeah.
So that in of itself is a major
I'll
problem.
weigh in on that as well because I ran into the same. I've got a server that Microsoft eventually doesn't provide updates to anymore, and they want you to get their new software. Part of the new software issue is the old hardware doesn't work with the new software. So companies are having to do this, and the data that's in this as far as updating and the lifespan of that is reasonable.
Okay.
This is a very real issue that anybody who has a server does face.
Did you do like due diligence to make sure this is the right server brand and everything that we want, or how did you choose the one that you want to get?
So I'll admit we leaned heavily on RTI, who has our managed services. So they looked at everything from how much traffic we're using. And so, they are an HP vendor. So they have a lot more expertise than I do. So that is how and there's different lines of servers. And so they looked at how many people we have and what line and how many years of service and that type of thing.
A smaller server with lower volume and lower internet access, you can get a range of $5,000 to $10,000. A lot of companies are going to online cloud-based servers, which I don't think would fit this application here very well. And you get cost creep with cloud-based servers that annually they increase the cost of it. And these things erode at your operating, out of your operating expenses. And I think it's better to have control over it and not have it just every year go up and up and up and up.
So we actually did look at that option, and that would be a costly option.
Yes.
The other part of it is currently we're backing up and we're backing up next to the server. Well, the problem with that is if this building burns down or blows away in a tornado, so does both pieces of your IT infrastructure. So it's not final, but I am looking to partner with one of our other political subdivisions who also use RTI to put our backup in their server closet, their backup in our server closet. And so we'll have the same people administering everything. And you'll know more about that because we'll have to sign an MOU and you all have to sign it. But we're still in the beginning of talks about that. But that's kind of an ideal solution because we're paying no cloud-based ongoing fees, but we have it someplace else.
You could put them in the bathrooms,
We could.
protected from tornadoes in there.
It's not very sanitary.
Very elegant. I applaud you for a very elegant solution.
You don't like the bathroom solution?
Come on. man.
Not my first choice.
But we were very excited to come up with that.
That's elegant.
And just being able to help another Platte County political subdivision help us and reduce, I mean, they're all our taxpayers, so we're reducing costs for them two ways. So that's pretty cool when we get to do something like that.
I move to authorize the director to purchase a new server and backup system for the health department at a cost of $22,525.15.
Do we have a second?
I second.
Okay, now this one we probably should have further discussion. Zach, anything you want to add?
I mean, I guess we're just relying on folks we've already used, we've been using their expert opinion. We don't feel like we need to look elsewhere. We're in such a hurry. We just don't want to take the time to look elsewhere.
So I have worked with this company for over 20 years and they have worked with me on multiple different things. I'm not an expert on the server side of things. Like most of the PC stuff, I am fairly well versed in, but I absolutely trust their recommendation and they're the ones who are doing our daily IT support and they know what complaints they actually are monitoring how fast the traffic is and all of that. So they have a really good pick, more than any salesperson would, because they see it daily.
Okay.
Kim?
So Andrew vouches for him, so if it goes sideways, we know which head goals.
Kim,
I
anything you
appreciate
wanna
that.
add?
Can we scratch that part?
I would make the admonition that if we do vote to approve this, we need to definitely budget for sunsetting this and in the future. So as we do the budget, we need to consider that this is a cost center in 5 years.
And that's what we had done this year.
Kim?
We knew it needed replaced.
I don't have-
You're good. Susan, you want to add anything?
I'm good.
Okay, I'm good too. So let's vote. Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Michael, yes.
Zach?
Yes.
Okay. Done deal.
I think that is everything for our regular meeting.
All right, and we're gonna go into executive session. So we need a motion to go into executive session.
Or do you, okay. Do we need to close this meeting though?
We'll close it
At
after.
the end? Okay.
Do we have a motion to go into executive session?
I move that we go into executive session 610.21, 1, 2, 3, and 13 RSMO 2000.
Do we have a second?
Second.
Okay, any further discussion? Okay, Susan? You wanna go
Yes.
session? Kim?
Yes.
Me, yes. Mike?
Michael, yes.
Zach,
Zach,
yes.
yes.
Okay, we're in executive session.
Yep.
Okay, what else am I supposed to
You
do?
asked him every.
I think I signed.
Okay.
Okay, we have just entered regular session from executive session, and we need to make a vote on the new contract for the executive director. So do we have a motion to do this?
I would move that we authorize the board chairman to execute the contract for Mr. Warland.
Do we have a second?
Seconded.
Any further discussion? Hey, Susan?
Yes.
Kim?
Yes,
Me? Yes.
Michael, yes.
Zach?
Yes.
Yes. Okay, contract's a done deal. I'll sign it and then you have to sign it as well.
Yep.
Do you need to have a witness or anything?
If we do it
Do we need
now,
a,
you all will be there.
do we need a notary public?
No.
All right.
17. All right, is there anything further that we need to discuss in our meetings at all? Are we good?
We're good.
Okay, we need a motion to end the meeting.
I move that we end the meeting of April 17th, 2025.
Okay, we have a second.
I'll
Okay.
second.
Okay, Susan,
Yes.
Kim, me,
Yes.
yeah.
Michael, yes.
Okay, so our next board meeting will be,
May 15th.
it'll be May 15th, 2025 at 6 p.m.
Yep.
It's a done deal.
Do you need?
Thank
these
you,
back?
everybody.
okay, you
No,
made the motion to
I
end
can throw 'em
executive
away.
session,
Okay, well,
I made the
He made the motion, I
Okay.
seconded.
okay.
and you seconded.
Okay, so May 15th.
And we adjourn the meeting?
Yes.
Yeah, we,
Yes, I
we
adjourn.
exited.
what is the month that we're having the goofed up, we're changing the date for the meeting?
June.
June is.